This is a presentation on experts that are going to speak about post-traumatic stress disorder and its treatments by Jennifer Newton. First, I'd like to give a brief overview of post-traumatic stress disorder, also known as PTSD, that affect veterans in America. PTSD in returning troops from overseas is significant and translates into thousands of service members being affected. Furthermore, millions of loved ones are also affected. Veterans with PTSD is becoming a large issue, with 20 veterans a day committing suicide in delayed healthcare systems. The topic of veterans and PTSD is a sensitive subject to many who suffer from it. Family members also suffer from it along with them. There is not a debrief surrounding combat issues when the military personnel return stateside. Sitting and bringing awareness to PTSD is important because PTSD is a silent killer. Veteran suicides accounted for 18% of all American suicides in 2014, with 70% of the victims not seeking professional help. Military veterans are hesitant to seek treatment because of the stigma surrounding speaking with a psychologist, and also because they are concerned of the implications it may cause. Further issues surrounding veterans with PTSD is that they have bad healthcare systems. Those that are left untreated can have further implications in relationships, workforce, and everyday life. Other issues surrounding PTSD is that there is not enough research to support an effective treatment method. Through this presentation, we are seeking to find: does exposure-expressive writing therapy decrease the daily struggles of PTSD and those that have served in the military? And also, does exposure-expressive writing help decrease the strains of personal relationships in veterans that are diagnosed with PTSD? Answering these questions may help further the treatments in service members that do not wish to seek professional help. Our experts are Joshua M. Smith and Dr. Brett S. Moore. Dr. Joshua Smith spent 20 years in the Marine Corps. Upon retiring as a master sergeant, he left with a bachelor's degree in psychology. He decided to continue his passion in psychology when he retired. He completed his doctorate and currently works at the Naval Hospital Cherry Point and also serves as director of the mental health ward. Dr. Brett S. Moore is finishing up her last year of residency at St. Mary's Hospital. She has a strong passion to help others suffering from post-traumatic stress disorder and hopes to do so through veteran affairs with her expertise in psychiatry, and would like to help with research and effective treatments for PTSD. Our first expert, Dr. Joshua M. Smith, and his colleagues wrote an article discussing the effects of life writing in veterans with PTSD. They further discussed mood in their daily lives. Results in the study showed no changes in PTSD diagnosis or symptoms. However, there were significant improvements in mood and post-traumatic growth. Expressive writing greatly alleviated neuroendocrine responses to traumatic-related memories, along with psychological response being reduced and recovery enhanced. Positive mood changes also improved in relationships and with their daily lives. Our second expert, Dr. Brett A. Moore, and colleague Walter Penck wrote a book surrounding treatments for PTSD. They covered medical and mental health treatments in their book and which ones were effective. Dr. Moore suggested that exposure writing therapy was a form of effective treatment. However, it is not the most significant form, and it should not be a primary focus. She also believed that clinical work is often based on the preference of the clinician. It may not be the best option for a patient. She believes that pharmacological research shows a greater promise in the treatment for PTSD in veterans. Furthermore, more research should be completed to have a better understanding of treatments for PTSD before concluding exposure therapy works. To recap, Dr. Smith believed that post-traumatic growth was observed through expressive writing. He also believes that expressive writing alleviated responses to PTSD, and a strong recovery was enhanced, along with mood growth and improvement in relationships. Dr. Moore, on the other hand, believed that other therapies are available to help those with PTSD and may be stronger. Also believed that clinical treatment was based on preference of the clinician and may not be best for the patient. She also believed that more research should be done before concluding that exposure therapy was the best treatment option. However, what they did agree on was exposure therapy showed evidence to support its use for PTSD and mood changes. Here you'll find a list of references to this presentation, and that will conclude the presentation. Thank you.